Hello and welcome back to Wally's Nursing Videos. Today, we're diving into the complex world of behavioral health disorders, focusing specifically on substance abuse and addiction. Substance abuse and addiction are national health problems with far-reaching consequences. Determining the actual prevalence of substance abuse is challenging due to various factors, but its detrimental effects are undeniable. Did you know that alcohol-related death ranks as the third leading preventable cause of death in the United States? That's a staggering statistic. Substance abuse doesn't just affect the individual, it impacts workplaces through absenteeism, and prenatal exposure to substances can have devastating effects on unborn children. Furthermore, substance abuse often correlates with increased rates of violence in communities. Let's break down the categories of drugs commonly associated with substance abuse. These are alcohol, sedatives, hypnotics, and anxiolytics, stimulants, cannabis, opioids, hallucinogens, inhalants. Each category has its own set of effects and risks, contributing to the complexity of substance abuse disorders. Now, let's delve into the diagnostic classes of substance abuse and important terms you should be familiar with. Intoxication. This refers to the physiological state induced by the ingestion of substances, leading to impairment in cognitive and physical functioning. Withdrawal syndrome, when an individual stops or reduces the use of a substance after prolonged use. They may experience a set of symptoms known as withdrawal syndrome. These symptoms can range from mild to severe and can be both physical and psychological in nature. Substance abuse. This involves the recurrent use of substances despite experiencing negative consequences. It's characterized by a pattern of behaviors such as neglecting responsibilities, legal issues, and relationship problems due to substance use. Substance dependence. Formerly known as addiction, substance dependence is marked by a strong craving for the substance, tolerance, needing more of the substance to achieve the same effect, and withdrawal symptoms when the substance is not consumed. Substance use. This term encompasses any use of substances, whether it's experimental, recreational, or medicinal, without necessarily implying abuse or dependence. Now, let's explore the onset and clinical course of substance abuse and addiction, shedding light on when and how these disorders typically manifest. The average age for the first episode of intoxication is during adolescence, with some individuals beginning experimentation as early as 8 years old. However, it's essential to note that the pattern of more severe difficulties often emerges in the mid-20s to mid-30s. Episodes of blackout where the individual loses memory of events during intoxication may occur, indicating the seriousness of the issue. One noteworthy aspect of substance abuse is tolerance, where the individual requires increasing amounts of the substance to achieve the desired effect. This often leads to tolerance breaks, periods of abstinence, or temporarily controlled drinking. However, this pattern can be deceptive, as it may eventually lead to an escalation of alcohol use and subsequent crisis, perpetuating a vicious cycle. For many individuals, substance use is a chronic illness characterized by periods of remission and relapses. Relapse rates are high, ranging from 60% to 90%. However, research shows that the highest rates for successful recovery are associated with abstinence and a high level of motivation. Spontaneous remission can occur but is less common. Poor outcomes are often associated with an earlier age of onset of substance abuse. Beyond substance abuse and addiction, there are related disorders worth mentioning. Gambling disorder. Similar to substance addiction, gambling disorder involves compulsive behavior and can have severe consequences on one's life. Caffeine and tobacco addictions. Though legal and socially accepted in many cultures, caffeine and tobacco addictions can also lead to significant health issues and dependency. Substances inducing symptoms. Similar to other mental illness diagnoses, some substances can induce symptoms that mimic other mental illness diagnoses, complicating diagnosis and treatment. Now, let's explore the factors contributing to the etiology of substance abuse and addiction. Biological factors, genetic vulnerability, and neurochemical influences play a significant role in predisposing individuals to substance abuse disorders. Psychological factors, family dynamics, coping styles, and underlying psychological issues can contribute to the development and maintenance of substance abuse disorders. Social and environmental factors, cultural factors, social attitudes, peer behaviors, as well as laws, cost, and availability of substances all influence an individual's likelihood of engaging in substance abuse. Now, let's delve into the critical aspect of cultural considerations in understanding substance abuse and addiction. Cultural attitudes toward substance use vary significantly across different societies and communities, shaping individuals' perceptions and behaviors toward substances. For instance, in Muslim communities, the consumption of alcohol is strictly prohibited, reflecting deeply ingrained religious and cultural beliefs. In Jewish culture, wine holds a significant place in religious rites and ceremonies, with its consumption being an integral part of tradition. Some Native American tribes incorporate substances like peyote, a hallucinogen, into religious ceremonies, highlighting the intersection of spirituality and substance use in certain cultures. Furthermore, genetic traits within certain ethnic groups can either predispose individuals to or protect them against alcoholism. For example, there are variations in enzymatic activities among Asians, African Americans, and white populations, influencing how these groups metabolize alcohol and their susceptibility to alcohol-related disorders. However, despite cultural variations, substance abuse can have devastating effects across all communities. For instance, alcohol abuse ranks among the top 5 leading causes of death for Native Americans and Alaska Natives, with approximately 1/8 of Native Americans identifying as needing treatment for alcohol or drug abuse. In Japan, alcohol consumption is not typically regarded as problematic or taboo, which can lead to high rates of alcohol-related issues. Conversely, in Russia, there are alarming rates of alcohol abuse, suicide, and cigarette smoking, particularly among the male population, highlighting the complex interplay of cultural, social, and environmental factors in shaping substance use patterns. Let's continue our exploration of substance abuse and addiction by focusing on specific categories of drugs and their effects. Alcohol, intoxication, and overdose. Alcohol acts as a central nervous system depressant, leading to relaxation and loss of inhibitions. Signs of intoxication include slurred speech, unsteady gait, lack of coordination, and impaired judgment. In severe cases, individuals may display aggressive behavior or inappropriate sexual behavior, leading to blackout. Overdose can result in vomiting, unconsciousness, and respiratory depression. Treatment typically involves gastric lavage or dialysis to remove the alcohol, along with support for respiratory and cardiovascular functioning in an intensive care unit. Withdrawal. Alcohol withdrawal typically begins within 4 to 12 hours after cessation or a significant reduction in alcohol intake, peaking around the second day and resolving within about 5 days. Symptoms include coarse hand tremors, sweating, elevated pulse and blood pressure, insomnia, and anxiety. Severe or untreated withdrawal can progress to transient hallucinations, seizures, or delirium tremens, DTs, which can be life-threatening. Benzodiazepines are commonly used for safe withdrawal management. Sedatives, hypnotics, and anxiolytics, intoxication, and overdose. These substances are also central nervous system depressants. The intensity of intoxication varies depending on the specific drug. Symptoms of intoxication include slurred speech, lack of coordination, unsteady gait, labile mood, and stupor. Overdose, particularly with barbiturates, can lead to coma, respiratory arrest, cardiac failure, and death. Withdrawal. The onset of withdrawal from sedatives, hypnotics, and anxiolytics depends on the half-life of the drug. Withdrawal symptoms are often the opposite of the drug's acute effects. Detoxification typically involves tapering the drug dosage to minimize withdrawal symptoms. Stimulants, amphetamines, cocaine. Intoxication and overdose. Stimulants act as central nervous system stimulants, leading to a high or euphoric feeling. Hyperactivity, hypervigilance, and anger. Physical symptoms may include elevated blood pressure, chest pain, and confusion. Overdose can result in seizures, coma, and even death. Withdrawal. Withdrawal from stimulants typically begins within hours to several days after cessation. The primary symptom is marked dysphoria, often referred to as crashing. Unlike alcohol and sedatives, stimulant withdrawal is not typically treated pharmacologically. Understanding the effects of these different categories of drugs is crucial for healthcare professionals in assessing, diagnosing, and managing substance abuse and addiction effectively. Cannabis, marijuana, used for psychoactive effects. Cannabis is often used recreationally for its psychoactive effects, including relaxation, euphoria, and increased appetite. It also has various medical applications. Intoxication. Symptoms of intoxication include lowered inhibitions, impaired motor control, impaired judgment, and potential delirium or cannabis-induced psychotic disorder. Unlike many other substances, there is no risk of overdose with cannabis. Withdrawal. While cannabis withdrawal does not typically lead to clinically significant symptoms, some individuals may experience insomnia, muscle aches, sweating, anxiety, tremors, and other discomforts. Opioids. Intoxication. Opioids produce desensitization to pain, euphoria, and a sense of well-being. Symptoms of intoxication include apathy, lethargy, impaired judgment, and physical manifestations like constricted pupils and slurred speech. Overdose can lead to coma, respiratory depression, and even death, but it can be reversed with naloxone. Withdrawal. Withdrawal from opioids typically involves symptoms such as nausea, vomiting, dysphoria, sweating, diarrhea, and insomnia. Symptoms can cause significant distress, but usually do not require pharmacologic intervention to support life or bodily functions. The duration and intensity of withdrawal symptoms vary depending on the drug's half-life. Hallucinogens. Intoxication. Hallucinogens cause reality distortion, often leading to symptoms similar to psychosis, including hallucinations and depersonalization. Intoxication may also include maladaptive behavioral and psychological changes, anxiety, depression, and paranoid ideation. Toxic reactions are primarily psychological, with no risk of overdose in the traditional sense. Withdrawal. Hallucinogens do not typically produce a withdrawal syndrome, but some individuals may report a craving for the drug. Flashbacks, or re-experiencing the drug's effects, can occur for months to years after use, particularly with potent hallucinogens like LSD. Inhalants. Intoxication. Inhalants produce neurologic and behavioral symptoms upon intoxication. Acute toxicity from inhalants can lead to severe consequences, such as anoxia, respiratory depression, dysrhythmias, and even death from bronchospasm, cardiac arrest, suffocation, or aspiration. No withdrawal or detoxification. Unlike many other substances, inhalants do not typically lead to a formal withdrawal syndrome. However, frequent users may experience cravings for the substance. Symptomatic treatment of related disorders is often necessary. Substance abuse treatment. Concept. Substance abuse is viewed as a medical illness that is progressive and chronic, characterized by periods of remission and relapse. Treatment models. Various treatment models exist, including the Hazelden Clinic model and the 12-step program of Alcoholics Anonymous. These approaches often involve individual and group counseling, with treatment delivered in different settings based on individual needs. Pharmacologic treatment. Medications may be used to manage withdrawal symptoms or cravings, but they are not specific treatments for substance abuse itself. These medications can aid in safe withdrawal and help prevent relapse. Dual diagnosis. Definition. Dual diagnosis refers to the co-occurrence of substance abuse and another psychiatric illness. It's estimated that around 50% of people with a substance abuse disorder also have mental health diagnoses. Treatment strategies. Successful treatment of dual diagnosis often involves comprehensive approaches that address both substance abuse and mental health issues. This may include providing a healthy, nurturing, and supportive living environment, helping individuals make fundamental life changes such as finding employment and building supportive social networks and ensuring treatment for comorbid conditions. Let's continue our discussion by exploring the application of the nursing process to substance abuse assessment, interventions, evaluation, as well as considerations for elderly individuals and community-based care. Assessment. History. Gather information about the individual's family life, family history of substance abuse, and any crisis that precipitated treatment. General appearance and motor behavior. Observe for any signs of intoxication or withdrawal. Mood and affect. Assess for emotional states such as tearfulness, guilt, anger, or unwillingness to engage. Thought process and content. Evaluate for rationalization or minimization of substance use and blaming others. Judgment and insight. Determine the individual's ability to recognize the consequences of their behavior. Physiological considerations. Assess for any physical health problems related to substance abuse, such as poor nutrition, sleep disturbances, liver damage, HIV infection, or lung damage. Data analysis, nursing diagnoses. based on assessment findings, formulate nursing diagnoses related to both physical health status and substance use. Outcome identification. Establish achievable outcomes such as abstaining from alcohol and drug use, expressing feelings openly, accepting responsibility for behavior, practicing non-chemical coping alternatives, and establishing an effective aftercare plan. Interventions. Provide health teaching for the client and family, addressing issues like codependency and shifting roles. Promote coping skills and non-chemical coping alternatives. Address family issues that may contribute to substance abuse. Facilitate individual or family counseling. Develop an effective aftercare plan to support ongoing recovery. Evaluation. Continuously evaluate the effectiveness of interventions and the achievement of outcomes, making adjustments as necessary to support the individual's recovery journey. Elder considerations. Late-onset substance abuse is a concern among the elderly, with risk factors including chronic illness, long-term use of prescription medications, life stress, social isolation, grief, and depression. Physical problems associated with substance abuse can develop rapidly among older adults. Community-based care. Outpatient treatment options include freestanding substance abuse treatment facilities, recovery programs like Alcoholics Anonymous, AA, or Rational Recovery, agency-sponsored aftercare programs, individual or family counseling, and services provided in clinics or physicians' offices. By applying the nursing process and considering specific factors such as age-related concerns and community-based care options, nurses can play a crucial role in supporting individuals struggling with substance abuse disorders and promoting their recovery and well-being. The ventral tegmental area, VTA, is a region located in the midbrain, specifically within the mesencephalon or midbrain. It plays a crucial role in the brain's reward system and is a key component of the mesolimbic pathway, also known as the pleasure-reward pathway. Here's a breakdown of the VTA and its role in the pleasure-reward pathway. Location. The VTA is situated near the midline of the brainstem, just above the pons and below the thalamus. It is part of the midbrain's tegmentum, which is a region involved in various sensory and motor functions. Neurotransmitter production. The VTA contains a population of neurons that primarily produce the neurotransmitter dopamine. These dopamine-producing neurons are especially important for regulating reward-related behaviors and motivation. Connections. The VTA sends dopamine-producing neurons to several areas of the brain, including the nucleus accumbens, prefrontal cortex, and amygdala. These connections form the mesolimbic pathway, which is essential for processing reward, reinforcement, and motivation. Reward processing. When an individual experiences something rewarding or pleasurable, such as eating delicious food or engaging in enjoyable activities, the VTA is activated, leading to an increase in dopamine release. This surge in dopamine acts as a signal to the brain that the experience is rewarding, reinforcing the behavior and encouraging repetition. Role in addiction. Drugs of abuse such as cocaine, opioids, and amphetamines directly or indirectly affect the activity of dopamine-producing neurons in the VTA. By hijacking the brain's reward system, these substances can lead to addiction by artificially stimulating dopamine release and reinforcing drug-seeking behavior. Implications for mental health. Dysfunction in the VTA and the mesolimbic pathway has been implicated in various mental health disorders, including addiction, depression, and schizophrenia. Understanding the role of the VTA in reward processing and motivation is essential for developing treatments for these conditions. In summary, the ventral tegmental area, VTA, is a critical brain region involved in the brain's reward system and plays a central role in processing pleasure, reinforcement, and motivation. Dysfunction in the VTA can have profound implications for mental health and behavior, highlighting its importance in neuroscience and psychiatry.